Previously we've talked to Chip Levy, who's one of my favorite interviews because we talk about a variety of things, but including the obesity paradox. This time we're talking about a really interesting aspect to this, premorbid body mass index and mortality after incident heart failure. And it's the Atherosclerosis Risk and Humidity study. I prefer it as Aric. And I am with Dr. Anita Deswal, who is MD, MPH, who is an Associate Chief of Cardiology at the Michael DeBakey VA Medical Center and Professor of Medicine at Baylor College of Medicine in Houston. Let's start at the very beginning. Why did you do this study?
So, as you probably know, overweight and obesity is very common in the U.S., and about over 2/3 of the U.S. population is actually either overweight or obese. And obesity by itself is an independent risk factor for the development of heart failure. However, if you look at obesity, once patients have heart failure, obesity seems to be, protective against mortality. In that patients that are obese or overweight, when they have heart failure, appear to live longer. And this is often referred to as what you were referring to, the obesity paradox.
Now, the Aric study, let's talk about that for a second and just remind us what that's about.
So the Aric study is, as you said, the Atherosclerosis Risk and Community study, which is funded by the NIH and is an epidemiological cohort study, somewhat like the Framingham study, right. Except in this about almost 16,000 participants who are drawn from 4 different U.S. communities rather than just one area. And this started back in 1987 to 1989. That's when the participants had their first visit, and then they were followed about every 3 years. For 4 visits, and then they had a 5th visit very recently. And they've been followed for various, outcomes as well as other epidemiological questions.
So in the December 30th issue of JACC, you're looking at about 1,500 participants?
Right. So we're looking at a subset of these Aric participants, and these are people that developed heart failure up until 2004. So after the baseline visit in 1987 to 1989 till 2004, about these 1,500 patients developed heart failure. And what we're looking at, as opposed to what's been looked at before in the obesity paradox, we're trying to see whether patients that have obesity or overweight before the development of heart failure also have a better outcome, because as you probably know, it's been postulated the obesity paradox is related to weight loss due to severe heart failure or advanced heart failure. But here we're actually looking at BMIs before they develop heart failure.
So what were the methods? I mean, how exactly did you design this trial?
Sure. So we took patients that developed incident heart failure, which was defined by either an incident heart failure hospitalization or mortality with heart failure. And we went back and defined their body mass index by a study visit, an Aric study visit, which was 6 months or more before that incident heart failure event. And actually the average was about 4 years before they developed heart failure. So we feel that's a good time point in which to define their premorbid obesity or overweight status. And then we looked at mortality for 10 years following incident heart failure. So we tried to look at the association of premorbid BMI with mortality after the development of heart failure.
And what did you find? Because it was surprising.
It was surprising in that we still saw that form of obesity paradox, in that the patients that were overweight or obese before they developed heart failure did better than normal weight patients up to 10 years of follow-up. And even after we corrected for demographics as well as comorbidities, this effect remained. A lot of people ask the question about whether there's a confounding by smoking as well as a history of cancer, because those patients are underweight or normal weight and are associated with higher mortality. But even when we did subgroup analysis by patients with a history of cancer or no cancer, or a history of smoking or no smoking, we still saw the same effect. It seemed pretty consistent across the groups.
I mean, in this country, unfortunately, obesity and overweight seems to be the norm. Did you actually find a healthy group of normal weight people to compare to?
That's a very good question, because about 80% of the patients were either overweight or obese. So about 20% were normal weight patients.
And do you think they're representative enough to, I mean, you say in the paper, you know, this is really a first in terms of linking overweight and obesity with lower mortality in patients with HF.
Right, and you know, I think now we have to try to figure out first, can we replicate this finding in other cohorts?
Right.
The second is, what are the reasons why this may occur? Why is obesity protective?
Yes. Why?
And I think, you know, we can all postulate various reasons. So the weight loss after development of heart failure doesn't quite explain the paradox that we found. Is it possible that the obese and overweight patients just have a higher metabolic reserve and are able to do better with the heart failure? Or there are some studies that have suggested an attenuation of the neurohormonal system in these obese and overweight patients. Maybe that's protective. The other thing, of course, is that maybe the obese patients just present earlier. Maybe it's a lead time bias. They're getting symptomatic earlier because of the body mass issues, or they have more comorbidities. Maybe they're seeing the doctor more and getting diagnosed with heart failure earlier. So maybe that's just a lead time bias, and over time this effect will go away. So I think we need to look at more studies to first replicate, find the reasons, and then I think that the main question that we all ask is, do we still advise our obese patients with heart failure to lose weight? And I think this study cannot tell us about that or inform us about that decision. And that would really take a clinical trial where you have intentional weight loss. And, you know, is that associated with better outcomes?
So what are you going to do? Are you going to do any more on this? It's a fascinating paper.
Exactly. What I would like to do is finally take this to the level of a clinical trial, but I think we're still trying to sort out, are there different mechanisms? Are there some obese patients that are healthier versus non-healthy obese where the heart is an issue, whereas in other patients maybe it's just the obesity and volume overload, you know, due to other conditions that's the cause. So we're trying to look at it with different means like troponin, you know, before the development of heart failure, etc. So we're in the process and don't have answers yet.
Well, for the very last issue of JACC for 2014, this is a great paper because it's got some real interesting information Dr. Deswal and Associates have pulled together from this particular study of the Aric data for CardioSource World News. I'm Executive Editor Rick McGuire.